It's a nationwide effort to create positive change for men's health by raising awareness. By participating in Movember, your mustache turns you into a walking, talking billboard for men's health. So here to tell us more about this campaign and the importance of raising awareness, local urologist Dr. David Drevna. Doctor, thank you so much for coming in.
Yeah, thanks for having me.
Of course. So let's talk about this. We're officially in the middle of Movember. How do you raise awareness simply by wearing a mustache?
I think for somebody who doesn't normally wear a mustache, it definitely brings attention to your face, and it makes people ask questions of why you would put such a thing on your face. And it allows me the opportunity to then tell them why.
So what all is happening during Movember?
Yeah, so I think during Movember, it's Men's Prostate Cancer Awareness Month and so forth, and so we're looking to raise awareness for people for screening purposes because prostate cancer is a very treatable disease if it's screened properly, found early, and they get the proper care.
How successful has this campaign been over the years? Do you think it's still getting the traction that it used to get?
Yeah, I think it's gaining success with that. I think for a while people were not screening as much as they probably should have, which led to a lack in their care later on or later findings. And so I definitely think it's brought screening to the forefront, which has allowed people to be diagnosed earlier.
Yeah, and you mentioned prostate cancer is what it's about. What do men need to know, and when should they start getting the screenings?
So I think any men between 50 and 55 years of age should be screened for prostate cancer. If you do have a family history of prostate cancer, you should be screened earlier. And the easiest thing is to get a PSA early, talk to your primary care physician, and then obviously they can send you over to a urologist, which would be able to help you.
What are some of these signs and symptoms that people should watch out for?
That's the scary thing with prostate cancer. There's not a lot of signs and symptoms until it's well beyond the initial diagnosis. And so really the PSA is kind of the first test that we use to screen men to see where they are in that cycle.
Does it seem like men are kind of more reluctant to go and get these types of screenings?
I think men are very reluctant. We don't want to be screened. Obviously, people always fear rectal exams and so forth, and so you don't have to do that necessarily. Just get a PSA and then let us at least start a conversation as to what goes next.
Now, if someone does have a family history of prostate cancer and say they're in their early 30s, would you recommend them getting started then?
Depends on probably when their father or whoever their family member was diagnosed. Usually within 10 years before whatever age their family member was, they should at least get a screening PSA to kind of get a baseline. And then start a dialogue with your doctor, and then that can help guide when the next PSA is drawn or how often you should check it.
Are there any other health issues or health issues that Movember raises awareness for?
I think men's health in general is something that gets pushed to the side, and so I think just starting a discussion with whether it be a PSA, which then talks about urinary habits or other such men's conditions, it can help get people to start talking about things that they otherwise wouldn't.
And so for the men who are at home right now watching, what would you say to them if they're kind of nervous to going in and getting checked out?
I would say most times urologists are pretty jovial people, and usually the conversation is fun, it's laid back. Try not to be scared of it. Talk with somebody. We'd be happy to see you in the office and take care of you.
And if they're looking for a urologist, could they come to you, and where
Absolutely.
can they find you?
Yeah, we're at NEO Urology. We have an office in Boardman, right next to Larisha's, and then also in Austintown, and we'd be happy to take care of anyone.
All right, perfect. Dr. David Drevna, thank you so much for joining me. I appreciate it. All right, WFMJ Weekend Today will be right back with more local news.